My name is Barry Capoli.
And I'm Carlene Capoli.
We have known each other since first grade, and I'd still be in first grade if it wasn't for her.
That is true.
My headaches began September 2015. Every day I woke up with a headache from day until night. And I was hurting big time. Couldn't drive, couldn't remember anything. My wife would tell me to do something. If it wasn't written down, I would not remember to do it.
And that was not Barry. He was always right there doing everything first. And so I realized that there was a lot, Barry was much sicker than what he was stating. So at that Monday morning, I had decided it was time to get some more professional help. He was not well.
When I was in ER, I remember I'm laying in the bed and the nurse came in and finally gave me an IV. And shortly after that, my headache started to go away, finally.
And once I saw that relief with Barry, I could relax a little bit myself. My first conversation with Dr. Lipson was Tuesday. He called me and said, "This is going to be the hardest conversation you've ever had in your life. You don't know me, but I'm very good at what I do, and I will take care of your husband."
I met the Capoli family when I was on call at Morristown Hospital back in September 2015. Mr. Capoli was having severe headaches involving the frontal part of his head, and when he went to the emergency room got a CAT scan that demonstrated a very large right frontal tumor, which needed attention with the neurosurgeon. When I met the family that evening, I went over the imaging in detail and talked to them thoroughly about the diagnosis. I think it's important that you give people very direct feedback about what they're dealing with, but also that you give them hope throughout this process. Patients with cancers like Barry's, specifically that glioblastoma, generally have a very poor prognosis. Usual life expectancy is about 14 months in median, with aggressive treatment including surgery, radiation, and chemotherapy. Without any treatment, patients generally survive 3 or 4 months only. As a surgeon, our goal is obviously to take out as much cancer as humanly possible, but we have to balance that with the risk of stroke or neurologic deficit. We don't want to make someone worse functionally while taking out all the cancer. Barry was very fortunate that with a careful operation, we were able to take out all of the enhancing material in the brain, which accounted for essentially 99% resection of the cancer cells. The rest can be taken care of but with chemotherapy and radiation, and Barry has been very lucky for that. Typically after cancer surgery, I will see patients every 3 months in follow-up, usually with MRIs to monitor the tumor. Barry was very fortunate the tumor never recurred, but he did develop some new symptoms. He had, after the radiation, some changes in his vision, some swelling in his face and his hands, and interestingly, he had an elevation in his growth hormone level. When we looked at the MRI, we saw a new cystic tumor, not in the area that we operated on, but separately in the pituitary gland.
Barry was also diagnosed with acromegaly, which is a very rare disease. On top of the glioblastoma, Dr. Lipson successfully performed the pituitary surgery on Barry a year afterwards, which would have killed him as well. So Dr. Lipson not only saved Barry's life once, but twice.
Patients with acromegaly from growth hormone producing pituitary adenomas generally have only a mediocre response to surgery. Only about 50 to 60% of patients get chemical cures. With a good operation and aggressive resection, we were able to achieve a chemical cure for Barry. We got the growth hormone level and the IGF-1 level back to normal. We improved his vision, and the best thing was he was able to go home only 2 days after the surgery.
Dr. Lipson is my guardian angel. He saved my life not once, but twice.
It was a blessing for us to have Dr. Lipson at the other end of that knife. It was an emergency situation, and Dr. Lipson came through. And it was just a blessing that our paths were able to cross. And I believe that it was fate that brought us to Dr. Lipson that day, considering the emergency situation, and we didn't know what was ahead of us, but we are blessed that it was Dr. Lipson.
So Barry has done really well. He's actually had a chance to spend his second winter down in Florida and avoid this cold. At this point, I'll see Barry every 6 months, really probably for 3 to 5 years, with follow-up MRI studies to make sure he remains disease-free. He's done exceptionally well. He's driving, he's active. You couldn't ask for a better patient and better outcome. I think both of us have been very lucky and fortunate with what we've seen.
A month ago, I had my last scan and everything was good. Dr. Lipson said, I'll see you in 6 months to a year. Whoopee!
He said, enjoy your life. We do go every 6 months to get a MRI scan, just to make sure that everything is clear and that we're good to go. So we will be in Dr. Lipson's care for the rest of our lives, thankfully.
I'm feeling great, and our future plans are go to the beach, travel, and travel. We're recently retired. We will come back for our checkups, Doc.
We promise.
We promise.